Special announcement, we are at Marshfield Clinic Health System today, and we are here with Dr. Susan Turney from Marshfield Clinic, and she is the Chief Executive Officer of Marshfield Clinic Health System. And Dr. Turney, thanks for being with us today.
Thank you very much.
Why are we here? What's the big announcement? You have a big announcement.
Well, this is a very exciting day for our health system, but for the state of Wisconsin. We met with our physician groups last night, and Gunderson Health System and Marshfield Clinic Health System are looking to come together. So we are at the very beginning of merger discussions to see what's possible to better serve our patients and families in the communities.
So I guess the question then would be why?
That is a good question. You know, when you think about what's happening not just at the state level but nationally, the challenges of medical care in the sense of rising costs, lower reimbursement, and really serving our patients in their communities is a challenge for any practice, but particularly in rural communities where we know the communities that we serve are the average household income is below the state and national level. We know that even with 50 clinical sites, patients oftentimes have to travel 30, 60 miles for a visit. And that's a challenge for our patients. Getting gas, childcare, maybe missing work, bringing a loved one in for a visit. So we believe that together we can continue to serve what will now be about 100 clinic sites and meet the patient's needs where they're at.
So a news release says Marshfield Clinic and Gunderson discuss possible merger. I guess if you're discussing a possible merger and you've put some time into this already, is this a foregone conclusion that a merger will in fact happen?
You know, what I believe is until you've actually signed the document, things can fall apart. However, I truly believe that as we do the due diligence that's necessary to come together, that it will not fall apart. We really believe that this is the future of healthcare, that providing the best rural healthcare that we can in not just the state of Wisconsin, but now expanding into Minnesota and Iowa because they already have a presence there. And I believe that we will be the preeminent rural healthcare system in the country. So you have to start somewhere when you're on this journey. And our first step was bringing our physician groups together last night to have the conversation. And now we have to go through the process of determining what a full integration will look like. And then, of course, there's a lot of other business needs that have to come with it. So we're at the beginning of the journey, but we're fully committed.
So what would that look like, a possible merger, from a branding standpoint, naming standpoint? Whose name do we see on the buildings? Who's in charge of what? That sort of thing. Have you had those discussions?
You know, naming is a question that a lot of people ask, and I don't have an answer, but I can say this. Gunderson Health System has been around for 125 years. We've been around for 103 years. And of course, we started in Marshfield, so that name has a lot of legacy associated with it. And physicians, the clinicians, other staff feel very passionate about who they work for and what they represent. So at this point in time, we have to think about allowing us to continue to understand the importance of the legacy, but think about the bright future that is in front of us. And hopefully for the next 100 years or more, if we come together, we will be able to continue to serve our patients and communities. So right now, it's a little early to talk about what it would look like, but I can tell you we all understand the importance of where we come from.
I see, and it says, you'll spend the coming months working out details of a possible merger. Do you guys have a timeline, in mind for when you'd like to wrap this up and, make some sort of announcement official?
If things go as planned, that would be unusual. Things always seem to take a little bit longer than even the most I'm an optimist, and I want things to happen quickly, but they don't always happen that way. But we do know from experience that when we acquired St. Joseph's Hospital here, we had a timeline, and of course it took longer than we anticipated, but you have one chance to do it right. So I think ideally we're thinking that we might be able to get through everything that needs to happen and be ready to complete the deal by the end of this calendar year. It might not happen in that timeline, and it might not happen at all. But again, we're very optimistic. We believe this is the right thing to do, and we're going to try to do it as quickly as possible, because I think being expeditious is important. If things linger on too long, it just gets a little stagnant.
Yeah. Been around healthcare for a long time, seen a lot of changes. This is, and you've watched this health system grow, from a clinic to many satellites, and
Yep.
you've just watched that footprint get bigger slowly and slowly. This is just having these kinds of discussions. This is historic stuff here.
It's Mike, as you know, I was here for 25 years and left for 10 years, and I came back here for one reason: I believe in this place. And I think we have done incredible things that in some ways we've had to, because we are rural, we're in a poorer part of the country, and we have a huge geography to cover. So I'm just really excited and thrilled about the opportunity to continue to innovate and to really expand what we can do in our communities. I think it's fabulous.
You always, a lot of these press releases, and they say, things like providing great care for patients and their families and their communities, and you talk very passionately about that. It's hard to see that, from maybe the corporate level sometimes. How do you keep yourself sort of grounded and sort of eye on the prize type of thing? How do you stay in touch with things going on at the patient level? You're not doing bedside care anymore, you're not taking appointments or things like that, but how do you do things to keep yourself sort of in touch with things that are going on at the patient level?
Of course, I practiced for years, and I love being in clinical care. And when I moved more into the administrative role, you never lose that passion that you have for patients, and that's what drives me every day. And again, I've been in Marshfield for decades and lived in northern Wisconsin most of my life. So I really understand the people that live here, the communities that we serve, and many of them are my family. So it does really create, it's really a very, it's just a deep passion for me to know that I'm helping people through the work that we do, and no one can do it alone. This is done with thousands of people across our health system every day. But I wander around the halls and I see the people that we take care of, and many of them know me if I'm in Marshfield, and they stop me and talk to me, and that's really, you have to stay connected. You have to know where your roots are, and that's just extremely, extremely important to me.
Certainly.
This is an exciting time, and it's the beginning of the journey yet. We are, Gunderson and Dr. Rathgaber, who's the CEO there, we're very excited to take the next steps, and again, to think about what's possible, and knowing that we are committed to this these communities that we serve, and knowing that we do a fantastic job already. It can only get better.
Well, keep us posted, will you?
I will.
All right.
You'll hear from us.
Dr. Sue Turney, Chief Executive Officer, Marshfield Clinic Health System.